Auckland City Mission has received nearly $17 million for more detox beds as it grapples with more people struggling with alcohol and drug addictions. The Prime Minister Jacinda Ardern and the Health Minister David Clark were at the City Mission earlier today to make the announcement. Our social issues reporter Sarah Robson has the story.
The government is pleased to announce today the funding for the cost of building 2 floors of the Mission Homeground building to house a total of 30 detoxification beds. That's an increase of 50% over the number of beds currently.
That was the Health Minister David Clark announcing to a packed room at the Auckland City Mission an almost $17 million funding boost for more detox beds. At the moment, the City Mission has 10 beds and there are 10 more at another facility in Point Chevalier. Today's announcement means there will be a total of 30 detox beds, and all of them will be housed in the City Mission's brand new building in the city, which is expected to be finished in 2 years' time. The City Missioner Chris Farrelly says there's been a detox facility there since 1982.
The City Missioner at the time vacated his house, which was down below, and said, use it in a temporary basis. We can fit 10 people in here, and as of today, that same place is still being used on a temporary basis.
That temporary detox unit has treated 14,000 people over 36 years. In the past, Chris Farrelly says most of the people had alcohol addiction. But these days, methamphetamine and synthetic drugs are causing the most problems. And Mr Farrelly says they're getting worse.
Alcohol and drug issues are now destroying the lives, are literally destroying the lives of individuals and families at a scale we haven't ever seen in New Zealand. So the significance of today is that we're able now to improve addiction services, treatment services for our population.
The funding for the new beds comes from money recovered through the Criminal Proceeds Recovery Act. The Prime Minister, Jacinda Ardern, says the money's going in the right place.
This is the largest scale spend from the proceeds of crime, but it feels entirely appropriate that we use the money that has been collected and accumulated through misery to end misery.
While the government's funding the building of the facility, Chris Farrelly says the Auckland District Health Boards will fund the detox services. But what about support for people when they come out of the program?
That's the challenge now. We're seeing some growth now around Housing First, where if these people are going through a Housing First program and being housed, there will be support services. I can't say that will be for everybody.
The new detox beds will be ready in 2 years. Chris Farrelly says that's not soon enough.
Of course we need it today. We need it today. However, we can now work towards this and grow some models of care. We're not only talking about a building, what we do in the building and how we operate it is equally going to be important. So it'll give us an opportunity to develop that with the District Health Board so that we can really have a true integrated service.
Last year, the previous government put $18 million towards the construction of the City Mission's new building. It also committed another $9 million over subsequent years for operating costs. Today's funding announcement is on top of that. Mō te hōtaka o te ahi, ko Sarah Robson, aho.